My friend and colleague, Mike Lamantia, called me on a Thursday when they recognized that they had their first positive tests of residents in the nursing home. And we put together a team of palliative care and hospice experts to help be on the ground. It involved a collaboration really quickly between the medical center staff, physician and nursing staff, and our colleagues at UVM Home Health and Hospice. That place was filled with people who were leaning into this as best as they knew how, not to abandon these people who saw Birchwood as their home and did not want to transfer to the hospital if they were to get sick, acknowledging that they would die where they have lived. So by the time we were there for a couple of days, we realized that we needed to provide 24/7 support. The medical center rented a RV that we lived in behind the Birchwood in dyads. We had made sure that there were 2 of us on call any given night. The chaplain we were working with was doing night rounds on a person who had been doing pretty well during the day, a man who had dementia. He was acutely short of breath. The image is striking, including what we see with disease, that the frothing of the fluids at the mouth can be substantial. And so I quickly put on my PPE and got inside. And when I came down the hall, the first thing I saw were the care aides at the bedside, who were, one of the things that was ubiquitous for our experience was that people working there were not going to leave the people they loved. They were going to stay there and they were going to see this through. And the aides were helping to change the music and change the lighting and do everything that they could to help, but were also terrified that this is not something they had seen and experienced. The nurse was there who met me and was leaning in as well, and also recognizing that the doses of medicines that she is used to doing are not working, and was similarly terrified. I came in the room and was there with our chaplain. We were able to, over the next 2.5 hours, get this man comfortable with doses of medicines that were not necessarily unfamiliar to me in a crisis end-of-life situation. And during that time, we were able to talk with the family who had been, our geriatrics colleagues had been in contact with his family right on through the process. We were very aware what this man's wishes were. The family was aware it was happening. And they wanted to be present so he wasn't alone when he was dying. And we were able to get them on the phone, and they were able to do some family rituals with him. And what the family asked us to do is take the phone and wrap it around his head, and so they could say, "You're loved here, you're loved here, you're loved here." And they felt very connected to him, and it was inspiring for me and to be in such an intimate space, and also disorienting to be doing that at a time when he was also not yet comfortable. This was hard for family to see. It took us about 2.5 hours to get him comfortable. In an acute care setting with the right medications and IV and subcutaneous medicines, probably would have taken me about 30 minutes or so. And we had been working for a number of days, recognizing we needed that. And we, from just a systems institution, regulatory perspective, we had been unable to achieve that by then. We did 2 days later, but that's an example of a systems level piece that made it harder to care for this man. Those coming 10 days have been the most meaningful of my professional career. We know that as unpredictable and different as this disease is, it's still a disease, and we have the knowledge of how to manage it. That when our institutional boundaries come down, like UVM came and brought an RV, they built a place for us to change our clothes and in and out of PPE, so we didn't have to do it in the bushes. That we can get the medications and the training for people to use them, and that people can feel they're not alone in it. They can have someone by their shoulder that says, yeah, you're doing the right thing, you're doing a good job, and this is hard, and I'm here with you. Those things are going to be what gets us through this together, and with a legacy that we can be proud of.